So welcome everyone to our Canadian Alliance to End Homelessness Training and Technical Assistance Housing First Community of Practice webinar call. I'm happy to be here to share a little bit with you today on the link between coordinated access and housing first, and we'll get more into that in a little bit. Just by way of some housekeeping items. Even though the topic is around the link between coordinated access and housing first, when we get to the discussion period of the webinar, you can ask questions or initiate discussion about anything you would like related to housing first. It does not have to be on this particular topic. We want to be able to provide a venue where people can ask as many questions as they want, get feedback and ideas. And as I mentioned early on, I want people to feel like they can join the discussion regardless of whether it was their question or not. So again, please keep yourselves muted until we get to the time that we are going to open it up for questions and discussion. When I mention your name or that it's your question that we're going to address, feel free to unmute yourself, and at that time, and then you can actually speak your question, and we can catch that in the recording and we can have discussion. If you have something to add to it, please let me know in the chat function or the question and answer function so that I know you want to contribute to the conversation that's happening. I'll be monitoring the questions that are presented there, and we'll be able to have some discussion then. If we don't have additional questions or any questions at all, then we may have a shorter webinar, and that's just fine. This webinar is being recorded and will be stored in our Training and Technical Assistance website under webinars. You'll be able to access the link to the recordings there, as well as there will be a link to a PDF version of the slides that I'm sharing today, if you so choose to pull those off and look at them later. So, as I mentioned, the link between coordinated access and housing first. So just to remind everybody about the Canadian Alliance. We are an organization that is leading a national movement of individuals and other organizations and communities working together to end homelessness in Canada. And so as you see, we have a few different facets of the Canadian Alliance. Built for Zero, the conference, the allied networks, and if you go on the Canadian Alliance website, you can actually read a little bit more about what the allied networks are. But also, of course, the Training and Technical Assistance, which is us. I do want to mention that that we are funded in part through the Government of Canada, through the Community Capacity and Innovation Funding stream of Reaching Home, Canada's homelessness strategy. And we really appreciate their support and the funding that helps us do what we do. Our mission at the Training and Technical Assistance, in short, is helping communities and organizations end homelessness with expert training and technical assistance. We have two streams of the training work that we do. One is through our contract with Reaching Home, where we're providing communities training and support around coordinated access. Those are the designated communities for Reaching Home. But we also will provide training to any organization or community throughout Canada in coordinated access or multiple other areas, specifically housing first and other best practices, through our fee-for-service consultancy. And part of that consultancy means that we have myself and other trainers, as well as a faculty of contracted trainers that I utilize to send across the country on different training topics to support people. And of course, I am Wally Check, the Director of Training. and I am very happy to be able to be here today to share some of this information with you. So our agenda, I'm going to talk a little bit about the dilemma related to coordinated access and housing first. I'm going to highlight philosophy versus practice in relation to those two things. I'm going to talk about the comparison between housing first and coordinated access. And then in the end, briefly kind of pull it all together. And then we'll open it up for Q&A and discussion. And then we'll close. So the coordinated access and housing first dilemma. It's important to understand that what has happened with the new Reaching Home proposal and strategy around ending homelessness. It has caused some people to, as you saw in the picture, scratch their heads a little bit because, as you see, the fourth strategy or directive under Reaching Home is coordinated access. And many communities had just gotten themselves comfortable with incorporating housing first as kind of the primary function in their federally funded projects. And we're getting those things squared away and had started developing a housing first approach to all of the work that they do. And we're buying into the housing first model. And then now with the new Reaching Home proposal, housing first is not highlighted as a primary objective, but instead coordinated access is. And so a lot of people have been wondering, well, what does that mean? Does that mean that we don't do housing first anymore? Does that mean that housing first has a role to play in the work that we do through our Reaching Home provided funding? And in addition to that, I wanted to add that what Reaching Home says under that fourth directive is that the requirement is all designated communities are required to have a coordinated access system in place by March 31st of 2022. So it's a heavy ask, and it's an important sort of all-encompassing ask. And how do the two fit together? So in order to do that, to begin with, I wanted to share a little bit of information in relation to the philosophy versus the practice of both housing first and coordinated access. I'm going to share a couple of pictures with you that I think illustrate that. And I've used these before in talking about housing first. So some of you may have seen this information. But I want to compare philosophy versus practice to making cookies. And so if you've ever made cookies before, you know that the cookie dough is probably the most important part of the cookie, because if you don't get the dough correct, then it makes it very difficult to have your cookies turn out very well. But in order to make the dough proper and effective and to work the best, you have to have a particular recipe that works for you, that you can follow consistently, and that it works all of the time, if not the majority of the time anyway. And that can be challenging to kind of decipher what that is all about. And so I think that when we talk about the philosophy around coordinated access or the philosophy around housing first, it is the same. The philosophy is the actual dough. That's the ingredients, the core ingredients, the important components that must always stay the same. But when you look at the cookies that are created from this dough, those cookies all look very different. None of them looks the same. They have different shapes, different colors, different kinds of sprinkles, different textures. But the one thing that is consistent about all of them is that they are made from the same dough. And so when we talk about coordinated access, every community's coordinated access system may look a little bit different. But it's important that every system, every coordinated access system, comes with the same ingredients for the dough and is made from the same dough. And we're going to talk about that a little bit more. Also, under the Reaching Home directives, it is stated the implementation of coordinated access is not a one-size-fits-all process. As such, it will be a community-led initiative where designated communities will have flexibility to establish a system that works best for their local needs. However, to help fully realize the benefits of coordinated access, a number of minimum requirements have been identified. Within the minimum requirements, designated communities will have flexibility to implement a system that responds to their unique needs. So those minimum requirements are part of the dough, or the ingredients for the dough. One of those elements is about the housing first philosophy. So I would suggest that philosophically, housing first on its own is the same as the philosophy related to coordinated access. Housing first philosophy needs to be intact. But to talk about this a little bit further, I want to talk about emergency room triage. Now, you've all heard this analogy, I'm sure, in relation to housing first and the importance of it not being a first come, first serve strategy or intervention, and that people need to be triaged based on the highest level of needs. But I want to sort of suggest to you that when you go into the hospital emergency room, it is not just something where you walk in and you demand services. Actually, maybe sometimes that happens, but they have a very specific process that is followed. There is a desk of some kind that may or may not look like this. There is one or more people at that desk that are have the role and responsibility of taking your information, pulling all of that together, recording that information in their database, and passing that information along to people who will make decisions about how the process is going to work from there and how you will get the best supports in that emergency room. Imagine, if you will, if that process didn't happen. Imagine if the process around the structure of getting your information and putting that information in a shared system that makes it possible for people to identify whose needs are the highest. Imagine what things might look like. And this might be an example of what things could look like in an emergency room if that process did not take place. There would be a little bit of chaos. And I think that it's important to realize how important that structure is when we look at hospital triage as well as coordinated access. When we have that structure in place, then our emergency rooms look more like this. And yes, I would say that oftentimes people are there with blank faces, but it is very orderly and less chaos that's happening, unless some huge tragedy or great emergency comes in and then people are kind of running and scrambling for a bit. But for the most part, you see people sitting in the waiting room, maybe in agony, maybe doing okay, but waiting their turn based on the triage of whose needs are the highest at that point in time. I want to also suggest to you that in that hospital triage or emergency room triage, when it is your turn and you get to go back and be served by the medical staff, there may be times where you have to go and have x-rays taken. And so you're not necessarily in the bed or the cubicle or whatever it is, and that space looks empty. But I want to remind you that the people in that emergency room know, even if you're not there, they know that you have gone for x-rays or that you have gone for some sort of a test of some kind, and that you still hold that spot in the emergency room. And how do they know that? Because there's communication happening, because there is things being documented and recorded in their database, so that they know not to give someone else that's waiting for service that particular spot. And so that communication and so forth is really important. And it would not work if there was not the information sharing happening, if there was not a central system for gathering and controlling that information. So Housing First is to coordinated access as what? Well, I wanted to talk a little bit then about coordinated access and let you know that I would suggest coordinated access is made up of multiple gears. And those gears are made up of, each gear represents something like what's listed here. You have various funders of different projects that are related to homelessness. You have the funded projects themselves. You have organizations in your community that provide housing to individuals, including those who are experiencing homelessness. You have outreach programs who are coming in contact with people who are experiencing homelessness. You have various other community supports, such as mental health supports or addictions assistance. You have employment programs. You have other kinds of training programs. You have education programs. You have other members of the community who have a vested interest and who care, and other stakeholders. You have people with lived experience who have a voice and want to have a say. You have people of other subpopulations that I didn't list here, such as we have indigenous groups and indigenous leadership that need to be considered, and so forth. And you have all of these gears that are in your community. And now that you've been given the directive of developing a coordinated access system, you may be sitting there with all of these random gears wondering how this is going to happen. How am I going to make this work? And what needs to occur. One of the things that you will learn on your own or through supports from us or other consultants or organizations around the country is that the important piece is that there has to be a process of developing partnerships. Many times in communities, we have all of those gears or services existing in a community, but they're operating in silos. And so an important part of coordinated access is creating a partnership which starts to pull those gears together and allow them to function in a cohesive, collaborative, coordinated manner. And those partnerships are ultra important, both formally and informally. Formally being partnerships that are based on signed documentation that describes what role each person plays. But there's also other types of informal partnerships that people have said, verbally, that we will do our best to provide this and make these services available when and if we can. Part of the goals outlined through Reaching Home indicates that their objective is to support communities to reduce chronic homelessness by 50% over the next 10 years. Well, what we know from research and from the past experience in relation to Housing First is that right now, Housing First is actually the best practice we have to date in terms of supporting and helping those who are the most chronic in homelessness, with the most challenging issues, with the most complex current disorders and so forth. Housing First is the best practice that we have. So when we talk about pulling all of those gears into place for a coordinated access system, Housing First has to be one of those. Housing First has to be included in that, because we will never, achieve this goal of reducing chronic homelessness by 50% over the next 10 years if we don't have Housing First as part of our practices and funded projects. In addition, Housing First is going to be the best approach that we have to address the needs of these people. And if we don't address the needs of those people, we're going to lose a lot of people's lives, and we're going to continue to have our systems and communities taxed at the highest level because of the efforts that we have to be making to address their needs. Because our current systems, the way they sit now, often do not address the needs of our most chronically homeless individuals. So if we don't have Housing First in place, we're going to be missing the boat. And so what I would say is Housing First is to coordinated access as hospitals are to emergency room triage. Because without the option of being able to take people from that emergency room bed and potentially move them into an actual hospital bed where they are getting served because their needs are extremely high at that point in time, what good is that emergency room? They are designed to work with people on a very quick short-term basis to assess their needs, to provide a quick level of treatment, and then to move them on to either something longer term or into a state of recovery. So without hospitals, emergency rooms aren't really serving the full gamut of people that need served appropriately. So that's what Housing First is to a coordinated access system. We have individuals who come through that system who are being assessed, who are being determined that their needs are of various levels, and are being referred to the programs and to the services that are most effectively set up and designed to provide those services. So Housing First is designed to serve those who are of the highest level of chronicity and of the highest level of need and complex issues. If we do not have Housing First, it's like not having the hospital. So then what happens is we have all of these gears put together, and they're turning and functioning in a collaborative way. One of those key gears, as mentioned, has to be Housing First. Now, that's the practice of Housing First, and the practice of Housing First has to be considered. But what I didn't mention is that we also have to include the ability to have our coordinated access system as a whole be a Housing First system of care or a Housing First friendly system. And so without that, it's going to be very difficult to implement all of the other strategies that we have. And so what does that mean when we talk about being a Housing First friendly system? That means that we include the philosophical elements of Housing First in as many ways as we possibly can in all aspects of operating that system. Meaning we adhere to the idea that housing is a basic human right. We adhere to the idea that we are going to remove as many, if not all, preconditions as possible to give people access to the appropriate housing and supports that they need. It means that we are going to prioritize people based on those of the highest level of need first, and that it's not on first come, first served basis. It means that we're providing supports to people and access to those supports, even if it's in an on-call basis on a 24/7 basis. It means that we are ensuring that people have supports on an ongoing basis based on a strength-based methodology and based on their needs and them being the drivers of the bus in their support needs. It means that we are working to give people financial assistance on a permanent and portable basis if necessary for rent subsidies and rental and income support. Because we know that as people improve in their recovery, even with the supports of Housing First, they might get to a point where they don't need those services any longer, but that doesn't necessarily mean that they get richer and don't need to have continual financial support. So when we move further along in the coordinated access system, we have the governance aspect of it and the controls associated with that system, where there are people in place that are monitoring what's happening in that whole system. ensuring that the process of intake, assessment, triage, and referral and movement through, tracking the inflow of people who come into the system, just like the hospital triage tracks the people that come into the emergency room. They record that information in a centralized database that is being shared with all of those who are involved in providing supports to those people. They are tracking the referrals that are made or the treatment that is prescribed to these individuals. And they are tracking their movement from that emergency room or from that intake process onto the right supports. And so they know if somebody has moved out of that emergency room or not. They know that people have moved out of that intake process or not. They know that people are moving on to a Housing First program or into the hospital. And so hopefully by this analogy that I've drawn here today, you can see the importance and the validity of Housing First may not be coordinated access, but Housing First is a key factor in both the philosophy and a key practice within a coordinated access system. And if you do not have Housing First practice within your system, then you are missing a huge, effective and important component towards making coordinated access as effective as it can be. So I'm going to stop there, and I'm going to open things up for any questions, any comments, any discussion about what I've shared today, or any questions that people have about their Housing First programs, their Housing First practice, anything related to Housing First in general. So I'm going to kind of just be silent for a minute and let people think about if they have questions. Again, please feel free to type them in the Q&A function. Or if you just have a comment that you want to make, that's great. If you don't have anything, that's okay by me as well, and we can close off early. I just have a few things I will share before we close, and then that'll be the end of it. But I just want to throw it out there. Did this generate any questions for you? Any thoughts? Or do you have any Housing First in general kinds of questions or things you want to talk about? I wish that I had the Jeopardy music that I could play. But I don't. So now I see a comment here from Barb from Thunder Bay. Great to have you again, Barb. You sent a question to the CAEH email. Now, I'm not sure what you mean by that, if you meant my personal email or not, I'm not sure. So if you meant my personal email, let me know. If not, feel free to type in your question, and then I can make sure it gets asked, because maybe you're on by phone. But you should be able to unmute yourself even on the phone, Barb, if you'd like to ask your question. If the email was my Canadian Alliance email, I can check that out. Oops. Yeah, no, it wasn't my personal email, Barb, but at least I didn't get it. So feel free to throw it out there. So I do, in the meantime, have something from somebody listed as an anonymous attendee. The question says, the services that we have in shelters are the same services of Housing First. And that's with a question mark. So I'm going to do my best to respond to that. But I'm not sure, to be honest, that I totally understand the question. if I was to rephrase that, I might say, are the services that we have in shelters the same services of Housing First? And my response to that would be that um, it is very possible, and it is a very good practice if you can build Housing First supports and services into a shelter. Oftentimes, shelters are set up for emergency supports, for people to be able to come in and have shelter over their heads on any given night. Sometimes shelters have a more specific mandate or purpose than that, but shelters with a housing focus are very much more in line with Housing First, because what they are doing then is they are moving from just sheltering people to a process of helping those individuals potentially, if they can, not even have to enter the shelter initially through some diversion services and programming that they might have there. But at the very least, helping people get attached to case management that will help them locate housing and provide supports for them once they are in housing as quickly as possible, and to be able to move to a stable living environment. So Housing First, in terms of a practice, is more about that ability to case manage people and either provide directly the services and supports that they need, along with supporting them in accessing housing and in stabilizing that housing, or be able to broker those supports to somebody through your case management. So if your shelter has that kind of function built into it, then the shelter is providing something that I would say is likely more in line with Housing First supports and delivery. But if your shelter is at this point still primarily just providing shelter for people on an emergency or nightly basis, then you likely are not providing Housing First services. So I hope that answers your question. If you have the ability to unmute yourself, whoever it is that asked that question, and want to speak to that further, please feel free to do that. In the meantime, Barb, I hope that you are have sent more. I do have some other here. Let's see. So I believe this is Barb's comments. The Housing First project we are currently funding has signed an MOA, Memorandum of Agreement, and joined the Coordinated Housing Access Table. Nidawin, which is the Indigenous program, has already agreed to be an Indigenous-specific access point for the Coordinated Access System, which the community plans to implement in November, or at least by the end of the current fiscal year. At this point in time, the Housing First workers at Nidawin are housing case managers and mainly help community members or their clients access and retain affordable market housing. They do assessments using the SPDAT and will also refer someone, a single adult, who scores over 30 on the SPDAT to the high need wait list for social housing. My question is about matching and referral once a person has been prioritized for housing services and supports through chat or through their coordinated access process. What role will the Housing First workers play under coordinated access? They cannot provide a housing vacancy as they are not attached to housing stock. However, they can offer a vacancy in the wait list for their support, I think is what was going to be said, and it was cut off. So it's a great question, actually, and I think it's a good point of discussion that oftentimes we get confused when it comes to housing first as well as housing supports. And some housing first programs don't have housing stock that quote unquote belongs to them. But they have to work the best they can with market housing and procuring landlords and so forth to be able to help their participants obtain that housing stock. What else often happens is that through a coordinated access system, housing stock is sort of captured and kept track of as to what housing stock is available to that coordinated access table. And so if an individual comes through that coordinated access system, they should be referred not only to a housing option, but also to a support option depending upon their needs. So if they are somebody who would benefit from Housing First supports, they can be referred to that Housing First program, and that Housing First program may or may not have housing stock available to them directly, but they should also be able to access the housing stock that is available to that coordinated access system, and therefore provide the supports for that individual to get access to appropriate housing and then continue with the supports. But again, when we look at Housing First and the Housing First philosophy, we also talk about the separation of housing and supports. So just because somebody doesn't have housing doesn't mean that they should be excluded from supports as well. And there are other things that can be accomplished for that individual, even though they may not be in housing at the moment. And so that referral, if they are appropriate for a Housing First program, that referral to that program is important regardless of whether that program has an immediate housing option for them or not, because then they can support them in the process of finding that housing and or accessing housing that's coming through the coordinated access table. Best practice in a coordinated access system is that there is a housing procurement function that is built in to provide to procure or to build a portfolio of housing options through housing providers as well as market landlords and so forth. And those housing options should be shared through all of the support programs that exist in that coordinated access system, which includes Housing First. But the housing options should also be prioritized to those of the highest level of need. So technically, people who are in a Housing First program should have first crack at housing availability through the coordinated access table. If that person who is in that Housing First program is hindered because they don't maybe have some of the documentation that that particular housing option is asking for, they may not be able to accept that housing option right away. If that's the case, then that housing option would be offered to the next person in line who is the next on the priority list or the prioritization list, which may be someone else within Housing First that does have all of that documentation ready or not. What we would hope, again, in a Housing First friendly coordinated access system is that there are more and more housing providers, including landlords, that might be willing to make concessions and allow people to move in even if they don't have all of that documentation readiness in place. But we realize that that may be a challenge for a lot of places and that a lot of documentation is required. But the housing portfolio should also be made available to people based on priority, again, not first come, first serve. So I hope that kind of answers your question, Barb, or speaks to it a little bit more fulsome. So I see that that my answer around the services in shelters, Housing First or not, apparently was somewhat helpful. So I'm glad of that. I don't see any other questions. Again, I'll open it up. Are there more questions or comments or things that anybody wants to talk about in regards to Housing First and or the link between Housing First and coordinated access? Going once, going twice. I do have a couple of things to share with you just at the end here. So if you do have another question, oh, it looks like maybe we do. Question is, what do you do if someone is receiving the services of Housing First, but that person during the very first day has been violent towards staff members and other residents? Also, this person has addiction problems. How do you deal with this situation? Yeah, that's a common question, to be honest, that comes up because people often struggle with what do we do when with these difficult or hard to serve individuals because of behaviors and so forth. But what I will say is if they are being served by a Housing First program, that again, part of that philosophy of Housing First, if you're truly operating from that standpoint, is that people are not provided services based on preconditions of any kind. That we don't say that they have to behave in a certain way, that they have to be free of addictions, that they have to be going to treatment in order for us to provide supports to them. Now, that doesn't mean that we just ignore things like violence towards staff members or other residents in a building. This is again where the separation of housing and supports come in. So a Housing First individual, one of the conditions or requirements that they do need to adhere to is the conditions of their lease or their housing agreement or rental agreement. So if someone is breaking the conditions related to their lease, which should be as much as possible a standard type of lease that anyone else would have, but if they're breaking those conditions, then they face the same sort of consequences that anyone else does who breaks their lease. They potentially can be evicted. And so that may be the case for somebody in that situation. If they are in a residence or a congregate living environment or a permanent supportive housing type environment where they are violent towards other residents that live there, if that's breaking their lease, then that might need to be addressed based on normal Housing First practices. So that's just the way it goes. If, however, there are certain conditions at play, and this is where the Housing First worker versus the landlord, and even though they might both be from the same organization, there needs to be a separation between who that Housing First worker is or who the support person is versus who plays the role of the landlord. That support person may have reason to be able to sit down with the landlord, whoever it is, and talk about some of the conditions or context associated with what's happening for that person. Maybe they were violent, but maybe that violence was based on a one-time situation that was related to them finding out some terrible news that caused them to go off and become extremely intoxicated and therefore lose control of themselves. Maybe that's not their typical type of behavior, and a case can be made to say, you know, we can increase the level of our support. These are some other things that can be done, or what have you, that might help to plead the case for that person. But in the end, the landlord has to do what they have to do based on the agreement that's in the lease. What we do not want to do, if you find out as a Housing First program that this person is violent towards your staff, no matter who that staff is, because you can look at things like maybe shifting who that staff person is, making sure that maybe you're going in pairs, making sure that if you know that that person is in a condition under the influence of whatever substances they use, that when they're like that, that's when they get violent, that we don't have our personal contact or we don't do our home visits and we come back another time. If all of those strategies aren't working and you need to find another support for that person, that's the key. We just do not want to discharge people from our program into homelessness. We want to make sure that people have the right supports and opportunities to maintain housing if they have it, or to find new housing if they don't have housing at that current point in time. So we don't want to leave people without supports, and if possible, we don't want to leave people without housing if we as a program aren't able to continue to serve them. So those factors should be considered very carefully before we look at discharge. I would also suggest that we would want to take a lot of time and really consider our practice with them as a Housing First organization. Are we actually understanding their situation the best that we can? Are we working with them to meet their needs in a client-centered way? When we go and do Housing First fidelity reviews with programs, we see a couple of consistent things when we have problems like that. One is we see that the team is often not working with that individual from a participant-centered perspective, meaning are the goals that we are working on with them based on the goals or the things that that individual wants to accomplish, as opposed to what the program thinks they should accomplish. And are we conducting our visits on a regular basis and having contact on a regular basis with that person? Are we using all of the strategies that we can possibly think of to support that individual? Those things should be discussed in your team meetings, in case conferences. I would also suggest that an individual who's been violent like this towards staff members and other residents and things like that be brought to a higher level case conference where you're including other partners and stakeholders that know that individual, and discuss different options that might be available and how to work with them. I would also get their input on what's going to be of the most benefit in supporting them. So I hope that that's helpful. I'll make my last plea for any other questions or thoughts that people want to have or add to this discussion. I really appreciate the comments so far. They've been good questions, and hopefully it's been helpful information. If not, I just want to remind people of, and I apologize for the circle that I've left on there. I think there. I want to give people an update on webinars that we have coming up. October 31st, we have our next by name list and coordinated access webinar that is going to be conducted by Ian DeYoung from OrgCode, and it is going to be focused on the topic of access in related to building your coordinated access system. So that would be things related to access points, what happens at an access point, those kinds of things. And then our next Housing First Community of Practice webinar like this will be November 28th. The topic and the presenter related to that is not determined yet, but you can go online to our website and register for those webinars. Again, I'd like to thank you all for participating. I want to remind you once more about the conference, the Canadian Alliance Conference that's happening, National Conference in Edmonton, November 4th to the 6th. If you have not registered yet, I would encourage you very strongly to do so because it looks like it's going to be another sold out event. We are probably going to be pushing 1,400 attendees or more at that conference. There's going to be some great things happening. So feel free to go online to the Canadian Alliance website and register for that. Lastly, I just want to thank you for participating. If you have additional questions around training and so forth, you can go to our website or contact me at this information listed here. Again, the recording of this webinar, as well as the PDF version of the slides, will be available by the end of day today in our webinar archives, again located through our website at training.caeh.ca under the menu item of webinars. So thanks, folks. Really appreciate your participation. Hope you enjoy the rest of your day, and have a great weekend coming up. But all the best to you. And well, let me just check one more time. It looks like there might be something else here. Oh, sorry. I'll address it, Barb. Last question. We've got about 5 minutes, so I'll answer your question. Could a person be matched to both a Housing First worker and a mental health worker for support? Who is the case manager for this person? Great question. The short answer to that is absolutely yes. There does need to be, I mean, that mental health worker is going to be doing some case management as well, but there does need to be someone who is sort of designated as the primary case manager. If they are going to need housing and supports in that housing, and they would be eligible or appropriate for a Housing First program, then they most definitely should be matched to a Housing First case manager, because that mental health worker is likely not going to be working with them in housing or support them in maintaining that housing. In that case, when both are involved, I would say that the primary case manager, the Housing First worker, should take that role. That does not mean that the mental health worker does not have ideas or appropriate things that they want to connect that person to, but that Housing First case manager should be making sure that they are connected to that mental health worker on a regular basis, and that they are sharing information, and that they are staying in sync with the work that they're doing together. So I'll leave it at that. If you want to know more about that, Barb, please feel free to email me again, and we can talk more. We can have a phone call or whatever, but it's a great question. So thanks again, everybody. Have a great day. Take care, and we'll talk soon. Bye for now.